So we know that whilst lockdowns really prevented the uncontrolled spread of the virus, it also unfortunately produced these unintended consequences for so many people, and it's acted very hard on them. And there's no doubt that the pandemic has changed the way that we all live, but the how will differ, and that depends on many factors. We know that there's a short term, a medium term, and a long term influence on the health and well-being of older people as a result of all these factors. We've been told really quickly that we mustn't go out, that we mustn't see people, our regular events stopped, activity stopped suddenly, and still to date, for so many people, they actually haven't returned. There are a lot of older people who are still living as they were through the pandemic. And this is because they are too afraid to leave their homes. They have lost their mobility. Their long-term conditions have deteriorated. So in the pre-pandemic times, people always said that, oh, we're rubbing along, we can manage. But the disruption to the support networks and their fears of leaving the house, the lack of exercise that they've done, and their struggles to get essential food and medicine, and the fear of catching COVID has left lots of older people in a challenging, frightening and distressing situation. And as a consequence, we know that there are growing concerns across all health and social care that malnutrition rates among older people are vastly increasing. And we know that pre-pandemic, 1 in 10 people over 65 in the community were malnourished. But I think that we know now that it's very, very likely to have risen as a result of everything that they've experienced over the last few years. People have found it really difficult to access food. And although everybody has pulled their weight across the public, the voluntary sector and local communities to support people, Age UK continue to have an increase in calls to their information advice line from older people still finding it hard to access food. Most are struggling because their usual network has fallen down. Many can't shop online because they're digitally excluded, or perhaps they can't get a shopping slot, or they can't afford to pay to have their shopping delivered. So this development became a huge worry for people who were not shielding. And those people who were not shielding had none of the priorities that other people had. And they were competing with everybody else to try and get their shopping slot. And this, I think, has carried on, and that people still feel reluctant to not have enough food, to find out how to get their food. They often fluster and panic. And this has left some very vulnerable older people without a regular, reliable access to food or medicines. And for those people who don't have a good support network, they are still having a big challenge. And it's been ongoing since the spring of 2020. So I think this shows how difficult it is for older people to come back to normal. I think a lot of us feel that a lot of the COVID legacy is gone now, but actually it really hasn't. During the pandemic, there was lots of confusion about who should go into people's homes. So older people were left without expected people coming round, their family, because they were worried about transmission, and care staff. Yesterday on the news, I heard an article which was discussing about the suggestion that relatives should perhaps stay away from older people. And it feels like mixed messages will again be causing confusion as who should go into other people's homes. We really need to learn those lessons from the lockdowns to be sure that we are giving out clear messages which will help older people to get the food that they need and to have the care and support that they need. Social isolation and loneliness, as Ruth mentioned, this has just been a huge growing concern. And it's just been made worse with all the closures of the day hospitals, community centres, churches, those spaces where people went. When we experience social isolation, it really does affect us. It increases our risk of cardiovascular disease, our autoimmune system, neurocognitive and mental health problems, as well as causing poor appetite. And all of these factors will increase malnutrition. So as I said before, it's been really hard for people who are in this situation, and this situation hasn't dramatically changed as we move out of the pandemic and out of the lockdowns. People are also feeling really isolated because we've moved on quickly. The world has left them behind. We've got a cashless society now. Assuming that everybody can shop online or shop in a cashless way, there is little support or guidance of how this would work. And older people are really not used to working in a virtual way. They're not used to doing their banking online. And with the closing of the post office and local banks, people feel really burdened. They tell us through the information and advice line that they feel really lonely, exposed and vulnerable. I think that's something that we really have to think about. How are we going to address this? And Trevor mentioned deconditioning. And it's really something that we need to get a grip on, because after months of reduced levels of activity, most older people are going to have an aspect of deconditioning and a loss of functionality. And it affects us, our physical fitness, our strength, our stamina, and our skill. And we know for some people who have been shut in their homes for so long, staying active has been difficult. And now they don't want to do it, or they feel that they can't do it. And this is so worrying because it can manifest as a loss of muscle mass, including loss of leg strength, which, as we know, limits mobility and increases that risk of falls. We also know that care home residents have been impacted dreadfully. Their mobility, well-being, their physical and mental health, and sadly even more for some of those people who were isolating in their room or those confined to their rooms for weeks on end. Aging Better did a really good survey, and they found that 1 in 5 people report that their physical health is worse because of the pandemic. All this is so worrying as we move once again into the colder season, with flu, respiratory disease and COVID likely to become a bigger challenge, as well as the worries of the cost of living rise. There's a few quotes here from what people are telling us about their day-to-day activities. And I think it shows how older people feel about day-to-day activities and how they are finding it difficult to plan, cook and eat. So in August, we thought we really needed to try and find out what was going on with people. So we did a series of polling. So we wanted to see where we are now, and we asked a number of questions relating to eating habits, weight changes, access to food and access to support service. And we found some really interesting trends here, which highlight that so much work needs to be done. I'll share some of the headlines that we've got. So we had 3 cohorts, 55 to 64, 64 to 75, and 75 plus. And we asked about 2,000 people. Interestingly, the trends were quite similar across all the cohorts. And when people were asked about the changes in their own weight, a third lost weight, a third had gained weight, and a third hadn't really noticed any weight change. Now we're going to look more closely into why people have put on weight, why they have lost weight. And we'll be doing something about that later in this year. And we'll be coming back to you with our findings. There was a slight difference of people who lived in the north that they had a greater proportion of weight loss than those who were in the south of England. We asked people about what support, and we know from talking to older people and from reading and listening to the news that the services that people once had pre-COVID are no longer there. And our poll really supports that fact. It showed that a staggering 78% of older people don't have access to a lunch club, a day centre, home help, paid or unpaid, Meals on Wheels or a casserole club. That support is not there. And interestingly, when we broke down those findings, we found that the 65 to 74-year-old were the people who saw the least people and had the least access to the support and felt that they needed it more than people who were older. So that's something else that we really need to look into, find out why that is, what's going on there for those people. We then asked people, what equipment do you have in your home? So as a society, we tend to make assumptions about what we have, what people have in their homes. So having access to the food you need is only one part of eating. Importantly, safe storage, preparing meals will only work if people have that right equipment at home to do it. And in our poll, we asked about ownership and access to a lot of common equipment. And we found out that 1 in 4 people didn't have a cooking hob. 1 in 5 people aged over 75 years didn't have a freezer, which is really worrying because that stops those people having meal deliveries, food that needs to be stored in a freezer. 1 in 4 didn't have a cooking hub, and only 50% of people had access to a slow cooker or a dishwasher. So we need to make sure that organisations such as the Department of Health and NHS and industry partners actually know that there's no point in telling people to do things in their tips and shopping and cooking and eating tips if people haven't got the equipment to do it. So not having access to all these things can silently restrict our access to food. And there again, people will be at so much more risk of malnutrition. And then we asked people about food preparation. And this was better because it said that 1 in 2 people buy ready meals. And those who do, 60% have a ready meal once a week and 30% have it twice a week. And it was interesting to see that people said that they were having a hot meal 5 to 7 times a week. And the poll suggests that 60% of people are still preparing their own meal, 75% of women and 56% of men. We know that older people find eating a social occasion. And we know that when people eat together, they'll eat more and better, and it's much better for the well-being of the individual. So 55 respondents said that they ate with somebody all of the time, which we think is quite high, but obviously we have to realise that this is just our segment of our population. And 32% ate with someone some of the time, and only 12% appeared to eat on their own all of the time. At the MTF, we think that that figure is much higher. And then we thought we'd ask about eating patterns. We know how important it is to eat first thing in the morning and at regular intervals during the day. It's important first thing in the morning that people eat, particularly around that time that people take their medication. And only 1/3 of people having something to eat first thing. But interesting, 1 in 10 people thought that they didn't eat as well as they should. And 4 in 10 felt that they ate better on some days. So that would give us the indication that they didn't feel they ate well every day. And 4 out of 5 people who responded said that they could eat any food texture, but 1 in 5 was needing some form of altered texture. And we know from previous work that we've done that this is not representative of what people need. And we know that there are many people still pureeing food in a blender and having very dark grey food, which is just a normal meal blended up. And we need to be doing something about that, because there are ways and means of getting the most delicious looking textured foods that make people enjoy their foods. Because even if you can't swallow, you need textured foods, you still need to have a lovely meal. We asked about eating, about drinking, and about fruit and vegetables. We found that actually people by and large were quite good with their vegetables and their fruit. We asked people what they would do about finding out information about eating well. And we thought that people might go to their pharmacy, but they didn't. And that's quite surprising, because obviously we think with the public health messages, the government messages, the NHS messages about going to your pharmacist, we would have thought that there would have been a greater uptake of people going to pharmacists. But that's interesting, isn't it? And those are the things that we need to know. We need to make sure that we're giving people the right messages, that we're signposting people to the correct place. And also to make sure that pharmacists have the information that people need. And I think it's more important that we try to upskill pharmacists or pharmacies, not upskill pharmacists, but the pharmacy to be seen as the go-to place for people in their community. Because with changes and access difficulties and the winter with primary care, it needs to be a place where people can get their information. We also went on to ask about people's access to shops, and we found that people really were finding it really hard to get to shops. If they couldn't do an internet shop, people wanted to try to go to the shop, but there was no transport. People who had a short walk now can't walk, so they can't get there. And we found that we need to really try and sort out some of the transport issues for older people, because they're just never going to get to the supermarket. And when they do get to the supermarket, they're saying how frightened they are to try and go round, because, you know, they're very, very large, particularly in the retail parks. So we're going to be talking to as many supermarkets as we can this year to try and let them know that they really need to do more for older people. We did another poll where we are nearly finished. I know I've gone on a bit, but there's such a lot to say. We thought we'd ask healthcare professionals what their perceptions were of the barriers to delivering nutritional care. Because we know that there are really excellent practice and service delivery all around, but it's not everywhere. And we wanted to find out what the barriers were. So we found, as you can see in our Wordle here, that it's about cost, about education, about lack of knowledge, lack of time. But there are some things that we can do straight away, and that's start asking questions and having conversations. Health and social care teams must continue to check for self-neglect, mental health needs, loss, grief and bereavement, as well as the risk of malnutrition. Screening for malnutrition risk is as important as any other aspects, because it will all influence the risk. So educating everyone, raising awareness of the risk, we really are all in this together. And we can easily take some simple actions such as asking, looking and listening. So 3 rules when we're trying to engage and we're looking and listening is never assume that everyone's taken everything on board. Double check. Even when you think you've done it as the best that you can, be consistent with the messages that you communicate. Keep them the same. Stop trying to confuse people and make sure we get our visual aids right. And obviously, we have to do this collaboratively. And true collaborative working is working with involving older people. And that's the end of my slide. So thank you for listening. Look at the website. We've got lots of hard copies that we can send out to you of all our resources. And you can request them from the website, or you can send me an email. So thank you for listening, everybody.